Well, good evening and welcome again to the monthly COVID-19 webinar series. I'm your host, the Immediate Pass. There's no pass like Immediate Pass. Brother Kelvin Ampofo, Immediate Pass, 2nd District Representative of the mighty 2nd District of the greatest fraternity on this side of glory, Omega Psi Phi Fraternity Incorporated. As always, I want to let our viewers know that the remarks and comments you hear on tonight from our guests and our brothers, those comments are their own. Does not necessarily reflect the views of the institutes that they represent or our fraternity, Omega Psi Phi Fraternity Incorporated. Certainly want to acknowledge our 2nd District Representative, Brother Del Rico Gales, who allows us to put this information, who continues to allow us to put this information out to all of our community. So, Brother Rico Gales, thank you so much for your leadership during these times. Well, let me introduce these men that have been with us for over 2 years, bringing you the most current update information as it relates to this COVID-19 pandemic. Certainly no stranger to us. We call him 78. Dr. Keith Boykin is a retired pediatrician. Always make sure that we have the most current information as it relates to stats. So, Dr. Boykin, good evening. It's always a pleasure to see you. And certainly also Dr. Jedan Phillips. He was at the epicenter of when this all began, giving us live updates from New York. Dr. Phillips, it certainly is good to see you, good brother. And brothers, brother doctors, I just want to ask a question before we even get started tonight. I want to ask a question. It's been over 2 years. We're getting ready to, go on 3 years. And obviously, the majority of the people just think that this COVID-19 thing is over. So I got to ask you, why are we still here? Why are we still providing this information? Because COVID-19 is over. So what are we doing? Why are we taking the time on a Wednesday evening to talk about something that no longer exists? What are we doing?
Well, I'm a family doctor, and in the past couple weeks, still seeing cases. We have what we call a special category of cases for people that come in with symptoms that may resemble COVID, and they require special preparations for the office in order to see them. I've had, I think, 5 of those cases in the past week that have come up. All 5 of them were positive. I've seen a couple people that are coming out of the hospital after having COVID. So again, if I was to talk to those individuals, it is still going on. And it's still something that we need to be mindful of, especially since politically we are now starting to even more so roll back a lot of our mitigating measures that were helpful before. And that doesn't mean don't do it. It just means that you need to assess your own personal risk and what is going on in the immediate area around you. I work in Suffolk County, New York. Suffolk County is still one of the high-risk orange counties in the state of New York. So a person traveling, going to the store, different activities out there would behoove them to wear their masks. So yes, I still think it's something that we've got to deal with. I don't think that we have to look at it in the same way that we did back in April of 2020. But for those that are vulnerable, unfortunately, some of the data and results are not much different than April in 2020. And what I mean by vulnerable are people with high risk medical conditions that can make your reacting or what your course with COVID could be make it more serious. And unfortunately, even though we have a vaccine that has shown that it is helpful and in preventing serious COVID and death, because we have so many that are under boosted, under vaccinated, or not vaccinated at all, that also puts them in a risky state of being. So I'm going to yield to my compadre 78, but I'm sure he's seeing a lot of the same things.
Well, good evening, everyone. And again, welcome. I can tell you, I am in, I agree with everything the president has done so far, but I disagree with the fact that the pandemic is over. And I'm going to tell you why. All right, you hear about cases are kind of plateaued or going whatever, but we're still seeing over 49,000 new cases a day. If the pandemic is over, why are we seeing so many new cases? We're still seeing over 353 new deaths daily from COVID-19. And hospital admissions around 3,700 or more a day. So if the pandemic is over, those numbers should be almost zero, if you ask me, in my humble opinion. So, over 95 million cases, still over a million deaths, and over 20,000 hospitalizations. So it ain't over. And I'm going to tell you why. Because if you look at things, and people are not paying attention to the news anymore, they're not really listening to what they're saying. They talk about the Omicron variant. So they think they only talk about BA.5 and BA.4. Well, I'm here to tell you, there's some new boys on the block out there too. There's this boy called BF7. That's a variant that folks don't talk about, but that bad boy is jumping up there, and he's getting pretty hefty up there in the population. I think it was formerly one of the BA.2s that kind of mutated a little bit. Then you got the BA.4.6, which is the next highest after BA.5. BA.4 is kind of going down a little bit, okay? And these are all variants of concern. You got a whole bunch of Omicron variants out there. Let's see, you got 1, 2, 3, 4, 5, 6, 7, 8, 9 Omicron variants. And what does Omicron variant do? It knows how to get around your immune system. It knows how to fool things. You can walk around here with totally no symptoms at all, and come up positive because it's hiding in your system. Okay, we have new vaccines out there, as Dr. Phillips said, to deal with all of this. We've got you've heard of the bivalent vaccines. Okay, they're pushing those. The government's pushing getting the bivalent vaccines, or a lot of them. We have a new boy on the block called Novavax, and Novavax has finally had emergency use authorization to be used as a booster now. So all those things are ongoing, and they're still looking at making new vaccines. So, vaccines is something we have to do commonplace, but to me, it's not over, because just like we saw in the beginning, there's so many people walking around out there right now that have COVID and don't even know it. And are spreading it to vulnerable populations. Why do you think they want everybody over the age of 50 and you have underlying conditions to get the bivalent vaccine? Why? Because if we don't, Omicron is going to go act crazy, and we'll never see the end of this thing. So, no, I agree. It's not over at all, in my opinion.
We talk about this thing called COVID-19, although many of us have seen people that unfortunately have passed away from this thing. But there's still some people that say, it's a gimmick. And even now we turn around and there's this thing that they're talking about called monkeypox. And so, again, people are going to have their views. People are going to have their opinions. But the question still remains, if I want to make sure that I'm protected, I want to make sure I do the best that I can, what are the things that I should be doing to make sure that I'm safe?
Well, it goes without saying. Every study has shown, statistically speaking, masking. And I know they said today that they're gonna relax all the masking requirements in healthcare situations, things like that. But I'm gonna tell you, everywhere I go, where I'm gonna be within 6 feet of somebody or in a closed population where the ventilation people, I wear my mask. It's very seldom you see me going without my mask. People look at me as if I have 3 heads, but I don't care. Because one of you is going to get COVID for thinking like that. And unfortunately, one of you may get very sick from that. So I take that to say that, you cannot stress the importance of wearing a mask. People saying you don't have to go home anymore if you got COVID. Some jurisdictions say you can go to school with COVID as long as you wear a mask. It's a little bit crazy, but at least it's something that they're doing. Not saying you don't have to wear a mask at all, but masking, washing your hands, because we do know that Omicron could be droplets in the air and on surfaces now. So that's how you can pick it up too, without being around somebody. You walk around, somebody sneezed on something, you pick it up, it's like in a common cold, and then you may get yourself infected. There's some evidence to suggest that now. But all the things we've been talking about all along. But the most important thing you need to do: vaccinate, booster, and wear your mask. Those are the 3 most important things I think are required.
Dr. Phillips, anything there?
No, I would agree with my brother. I mean, again, unfortunately, in the people I've seen that are getting very sick, being the theme of being non-vaccinated or under-vaccinated or under-boosted is common. But I think, unfortunately, it speaks to, number one, how deep the reluctance for the general population of us to trust. I think that trust has really been impacted, and it's going to take some time and some consistent effort, consistent leaning in to really get people to understand. I think, like we look at our fraternity health objectives, we talk about the importance of preventive health. We are not in a preventive health mindset. So when you're not in a preventive health mindset, why would you consider things that may have a beneficial effect from a preventive standpoint? You're not going to think about it. You're just going to be thinking from a reactionary standpoint. So we got to get people to go get their physicals. We've got to get people to know what their numbers are. Because again, not knowing those numbers, not being aware of those risk factors is also just as deadly as not being vaccinated, because those conditions can make, if you are getting COVID, it to be a deadly situation for you. So I do think that activities like what we're doing right now in talking to the community, they need to continue, because we've got to be the bridge that helps bring our population back to our medical profession. Because of the history, there's a lot of reluctance, and that reluctance in this social media realm has, I think social media provides excuses to continue with how you're thinking. And I think that doing activities like this is important, because we've got to understand what the concerns are of people and why they are reluctant. And we've got to lean in and be consistent in trying to educate the things that they're not aware of, that they don't know, that they are not valuing or showing importance to, that can be impactful on what may happen to them down the road.
Dr. Phillips brings up a very good point. This COVID-19 has impacted a certain population that's very important to us. And this is from the vaccine realm. Think about it. All the hesitancy, all the misinformation, and all of the lack of access to care has brought about a new thing in the pediatric realm. And I think you guys heard me talk about it before. Because of all the misinformation and distrust and things like that, our routine childhood vaccinations have fallen below the natural herd immunity that we expected by having people fully vaccinated. People not going to get their well child care. Adults not getting their, if you're diabetic adult, you're not getting your pneumovax. You have to have 2 of those pneumovaxes. If you're over a certain age, you're not getting your shingles shot because of just misinformation. So I said that to say this: we may be looking at a lot of things that we used to didn't even worry about, we used to didn't even see. But now that we've had all the, the lack in healthcare, the lack in preventative care, we can see a lot more things happening. More heart disease. We're gonna see a lot more measles. I'm getting ready to leave the country to go to the motherland in next month, and I got to have another polio vaccine, even though I'm fully vaccinated against it, because those things are just cropping up. Those things are just cropping up out there. So, I mean, preventative health is most important, and I think COVID has brought about a focus on it more than ever, because that's been the most impacted thing is preventative health and access to care during this COVID vaccine. So I'll yield back to you at this time, brother.
Yeah, let's segue into the importance of healthcare, because I know that a lot of people, even just when they hear COVID-19, they want to kind of tune us out. So as we segue into healthcare in general, let me at least finish COVID as it relates to screening for COVID. So testing for COVID. So I understand that now if you are going to, or if you want to get a test, and obviously we still have the free home test. Those people that got them, you may still have some home tests in your homes. make sure you check the expiration date.
Yeah.
Right. I understand. Make sure you want to check the expiration date. But for those that, for whatever reason, they decide that they want to get an actual PCR, I understand that insurance is only covering PCR tests if you've been exposed, or there's some prerequisites, if you will, before you can get a PCR test. Have you all heard anything about that, or can we speak to that a little bit? If somebody wants to get a PCR test, as far as insurance coverage, things of that nature, have you guys heard or seen anything?
Use Dr. Phillips on that one.
Well, again, insurance will cover COVID testing. Insurance will cover it. It's important to make sure you have that information. How many people have gone to these urgent care facilities and they don't have the information? So, if you're going to go, make sure you travel with your appropriate insurance information. I know in my office, we cover the rapid, we cover the PCR tests. So most insurances, if not all, will cover those tests. But if you don't have your card with you, there's no reason that they should look out for you. So just make sure you're prepared for that interaction.
And I tell you, I am a member of a large HMO. A lot of people know about Kaiser, and they would certainly cover it for their members. So, everybody thinks HMOs won't cover things because they don't want to pay for stuff, but it's just the opposite. The Kaiser, I know, having worked for them for 20-some years, they are big on preventative health. So, yeah, they will cover it. I don't know about, like Dan said, I don't know about the other general insurances out there. But.
Okay. So now let's get into that healthcare. Let's get into getting your checkups and all that stuff. A lot of times there's people, for whatever reason, they just don't want to go to the doctor. They may not even have a primary care physician. Let's talk about the importance of getting those screenings and things that you can find out from visiting your healthcare professional for annual or biannual screening.
Hey, I think we can go back to the beginning of the pandemic and looking at why our community was the low-hanging fruit when it came to suffering from COVID. It came because, number one, we don't use preventive medical services at the same levels that our white counterparts do. Right. So, number one, you get COVID, who do you call to find out what to do? We saw in the beginning, because of the overwhelming amounts of people that they were seeing in the emergency room, that they did not have the time or opportunity to give preventive patient education about how and what you should do if you are COVID positive. So I think, number one, having a primary care physician gives you a place where you can go if you have a problem. Secondly, we've got to look at what type of medical conditions were putting our groups at a higher risk. Most of them were preventive chronic conditions. We suffer a higher degree of heart disease. We suffer a higher degree of stroke. We suffer a higher degree of diabetes. We suffer a higher degree of obesity. All of these conditions made us low-hanging fruit when it came to COVID. So it would only seem reasonable and logical that in order to not make yourself, as Dr. Boykin just said, there's a new player in town, B67, or I'm not sure the exact numbers, but there's a new variant. And that new variant, just as we've seen with the Omicron variant, which, as I said on our last call, if Omicron was here in April of 2020, we might be looking at 300,000 to 400,000 more people that would be dead right now.
Absolutely.
So and the reason that is because of how infectious it is and how quickly it can infect. And now we know that the symptoms are milder. So that means that if we don't take advantage of the protective measures, if we don't lessen our risks, then we are putting ourselves right in the way for this to hit us again. And what we have seen is that the serious infections, the hospitalizations, and the deaths tend to be in individuals that are not appropriately vaccinated or boosted.
Powerful, powerful. So, with that being said, Dr. Phillips, if you can, let's just, a lot of times we take it for granted. I think that we sometimes make the assumption that people know what to do. So let's walk somebody through. If for some reason somebody doesn't have a primary care physician, where can they start? What are some steps that they can do to try to get a primary care physician so that they can seek that health care?
Well, if you have an insurance plan, you can look in your insurance plan provider guide, which is available either in print and most times it's available online. And you can look for a primary care physician that's in your community. One of the things that we're trying to develop as Men of Omega nationally is we're trying to develop a health and mental wellness database of providers. So if you want to see somebody that looks like you, that you feel comfortable with, you can find that individual as well. However, I would not delay initiating your interaction with a physician or a healthcare provider to waiting for the right person, because it takes a little while sometimes to find the right person, and COVID and other health issues may not be on the same type of time.
Yeah, Dr. Phillips is absolutely right. First and foremost, seek a physician. It may not be the one you stay with, but seek a physician somewhere. In this day and time, everything you want to find out is right out there on social media, on the internet. You want to find a physician that has certain practice and takes certain insurances, go to the internet. If you want to know about that physician before you choose him or her, you can look at their health grades. There's a thing called health grades out there, right? Also on the internet, you can say, well, I want to go see Dr. Boykin. You can go look on the internet, see where I practice, who I practice, what insurances I take, and how people see me. So it's very easy. If you don't have insurance, that's not means that you don't have access to healthcare either, because there's always an agency out there somewhere that you can check into to start to initiate the process. A lot of people end up in the emergency room or in urgent care for whatever reason, insured or uninsured. Even the people that are uninsured, at least in my experience and here in Virginia, if you go to the emergency room for whatever reason you have, and that emergency room physician finds out that you have something like hypertension, or suspect you have hypertension, or you have diabetes for the first time there, they will make recommendations to you. And most times they even make a follow-up appointment for you to see a certain doctor at that particular time. And when I was in active practice, we had to take call, and we took a certain amount of those patients that didn't have insurance company. And we gladly took them because, in my opinion, I want somebody to be taken care of rather than go out there and die because they don't have access to care. I want them to know, but if you look like me, you can still get care, regardless of what the color of your skin, because I'm going to advocate every single time for you getting care. If you've had to give it to, free myself to you, you will get care at some point. So it's out there. Just look for it, look for what if you have Medicare. Let me just talk about Medicare a minute, because that's a very important one, because you spend a lot of time trying to figure out navigate that maze of Medicare. What do I need to do? What do I have to do? There's so much information out there in Medicare. You almost get Medicare overdosing, if you will, but it's easy navigable. You just got to find somebody who would willing to take the time for you and understand what your needs are. Because there's certain things you have to take care of as a Medicare patient. Even though the government is providing you insurance, you have to pay for your Part B. And then you need to think about your Part C and D. So those are all things to be considered when you need to make sure you choose a doctor that's fully participating in Medicare. You don't just go there and say, well, I'm going to go there and see what's happening, because you might get stuck with a bill. And nobody wants you to do that. But all the information you need, I said all that to say is all the information you need is out there somewhere, somehow. You can always ask somebody in your community. You can ask people like me, a retired doctor. I don't care telling you how to get access to care, but the information is out there.
And then once you get in to see that doctor, you can find out what your numbers are, and then they'll construct, a strategy that you need to have to address them. What for the people that don't want to take medicine, what are the lifestyle changes that you need to make? And, how do you need to follow up on that to make sure everything is all right? So, I think operating in the unknown is setting you up for failure.
Dr. Phillips, go ahead, Dr. Boykin.
And remember, you are not a silent participant in your care. It's a partnership. You and your doctor need to develop a strategy, like Dr. Phillips, a plan of care for you, because you know what you're going to do, you know what you're not going to do. So you and your doctor need to talk about how to make it so that you are, first of all, have a medical home, A, and B, that you're fully involved in your care. It's not a one-sided street anymore. You are fully involved in your care.
Dr. Phillips, you said something that was very interesting. You said that if you don't have, or if you don't want to take medication, then you and your doctor can figure something out. Can you talk a little bit about uh, those people that may not want to take medications, but maybe that may be the course for them, but they, for whatever reason, they don't want to take medication? What are some options for them?
Well, I think again, everybody. I don't think all of us, if we can avoid taking medicine, would say, no, I don't want to take a medicine. However, I think when we look at the conditions that affect our community, a lot of them are chronic, preventable conditions, and heart disease, diabetes, all of these conditions have a component of it that can be impacted by you making some substantial lifestyle changes. And for us to think that health comes in the form of taking blood pressure medicine or any other medicine without healthy lifestyle habits, that's not real. And I think your doctor will help you as far as giving you some goals. Look, you need to lose 40, 50 pounds. You need to get this amount of exercise in regularly. These are some of the things that you need to do. And if you do them, again, with your doctor, you can work on monitoring, say, cholesterol. I got a patient that just came in. He's like, I don't want to take cholesterol medicine. All right, cool. So this is our exercise and diet plan. We're going to recheck your blood work in 3 months. And if it's not better, then we got another conversation we need to have. I think if someone ultimately has to take medicine, that probably is a more palatable way for them to take it, unless, of course, they've got some numbers that are incredibly abnormal and there's no room for waiting.
Dr. Boykin, as always, you always help us out with our youth. Certainly, many parents are always wondering about their kids, things that they should be mindful of, checkups, whether it's masking, whatever the case might be. What messages do you have for our parents that have children that are in these school systems?
Well, I first and foremost, I think you should look at the community transmission levels in terms of COVID. That's the most important thing. If you don't hear anything else I say tonight, if it is a high level or moderate to high level risk, I would highly recommend, even though your school may say you don't have to wear a mask, I would highly recommend that your child wear a mask at school. If your child's old enough to be vaccinated, please really consider getting your child vaccinated, because we know we have prevented so many childhood illnesses, just routine vaccinations, and we can do the same thing with COVID here. And we know now that if you're 12 years and over, you can get the bivalent boosted, and the new one now that protects against Omicron. And there's even research now going on to try to get it from 5 years and above. Pfizer's as always on the leading front of getting the bivalent for those children under there. But the most important thing is teaching your child how to recognize if they have some symptoms. If they don't feel well, don't just blow it off. Let you know what's going on. Or if there's something going on in school, they need to tell you as well what's going on in school. Have a conversation with your teacher. Be in touch with things. Go to the PTAs, find out what's going on in that particular school system. Because, if you don't ask, they're not going to tell you in a lot of situations. But make sure your child, if particularly in a moderate to high risk community, check your levels. You can go to the CDC's website, put in your state, and you can put in your county or your city and see what your transmission levels are, and then you govern yourself accordingly. And they have routine information on what you should do as an individual based on those high levels. So get your children vaccinated for all the things you're supposed to, particularly the flu shot. Now, I can't stress that enough, because who dies mostly from the flu? Young children and older adults. Always, every year, the highest incidence of deaths are going to be in young children and older adults. So please, please, please consider getting your child a flu shot. You cannot get the flu from the shot. You may have some symptoms from the shot that are related to just body reacting to the vaccine, but it's not the flu. So please consider getting your child the flu shot.
That has been a big conversation piece with my pediatric patients and their parents is, Doc, you think they need this shot? You know, I've already done this shot already with them. You know, do they need a second one? You know, and again, just like we've talked about throughout the pandemic, unfortunately, you've still got to, not unfortunately, but unfortunately in the sense that it still exists, you've still got to find out why you scared of all of this. And then address those concerns and then lay out what the risks are if they choose not doing anything.
Yeah, risk versus benefits is always important to talk about, and people can assume their own risk if you laid out the benefits for them. But that's your job as a physician, is not to push vaccines necessarily. We want you to be vaccinated, but we need to help you understand the risk versus the benefits. And there are far too many times where the benefits outweigh any risk of any vaccine, because one of the biggest risk of a lot of diseases and infections is what? Death, a permanent illness, such as we see in long-term COVID. You know, the highest incidence of people with long-term COVID are those that have not been vaccinated. There was a question about Black people have a problem of not getting to see a doctor. Well, that's another mindset. You know, it's always a paradigm shift, a mindset. You have access to care now. You just have to choose to use it. Don't be told that you don't have a physician there, because somebody out there somewhere will gladly take you on as a patient. Somewhere out there somewhere. That's just my personal opinion. Other people may disagree with me, but there's always someone out there. And the other thing is that if you look like me, you know, I'm going to be an advocate for my own people that look like me, but I'm also be an advocate for anybody out there.
Is there a certain time frame? Oh, you talked about flu season. Is there a certain time frame that people should be getting flu shots, if you will? Is a time better than the other? Now, next month? What's talk to us about when to get these flu?
The best time to get the flu shot is when it first becomes available in September, or actually some people give it as early as August. But here's the thing with the flu. The peak of the flu season is around December, January time frame. So you want to get vaccinated early so you can be fully have developed antibodies against it. But you can be vaccinated anytime between September, and I've vaccinated people all the way up to June of the following year. So maybe July, August, you may have some time off. But, you know, flu shots are almost going to be just about given year round. You know, we know that one summer we had the H1N1. You know, we started vaccinating people in July and August for that particular bad boy, because that came out at that time. It didn't wait to September, October, November, and December. It came out then. It was a big problem. It was a endemic at that time in this country. But, you know, my opinion is that you should get as soon as available. And please don't say, well, we are here in January, February, March, I don't need your flu vaccine. No, you still need to get the flu vaccine.
I try to do it whenever I get them in the office. If I get them in the office, because again, what we're talking about is a difficulty or a challenge that people have in getting into the doctor's office. So I find that even if you get them early, because in years before they would wait because of the concern that the immunity conveyed by the vaccine would dissipate by sometime in the spring, which is additionally during the flu season. However, as we have seen during the pandemic, that we can't afford to lose those individuals. So I've got a whole bunch of people. They're like, well, should I wait till November? Well, if you're here right now, get the shot right now.
Absolutely. Absolutely.
You know, and what I would say, because we have the ritual of homecoming, and October is homecoming month. And I'm sure everybody wants to be in everybody else's face. However, you know, if you one of those people like Dr. Boykin and myself, we get the calls on Monday, dog. Everybody that was with us got COVID.
Mm-hmm.
Dog, I just picked it up and I was just at such and such. You want to make sure that you do your best to protect yourself, because as we have said throughout, the federal government is not taking the responsibility anymore for your safety. They're going to give you things that can make you safe, but they're going to leave that decision up to you because of how we kicked and screamed and kissed our teeth about being told what to do.
You know, I was trying to go I was trying to go down one road, but as always, Dr. Phillips, you bring us back to the reality. So let's go back to it. So you mentioned homecoming. I think even from people's professions, I'm not sure if you've seen it in the medical profession, but I know in my profession, I've seen where more and more meetings, more and more conferences, they're starting back up and they're starting to do this in-person thing. So in addition to the homecomings, I think even right now we're in the middle, we're in progress, right? CBC is going on right now. So as people decide to venture out, if you will, whether it's a homecoming or whether it's a professional conference related to your employer, please reiterate the importance of what we should be thinking about when we're in these settings.
Well, I want to say one thing, and I'll hand off to Jedan. But first and foremost, expect that you will be infected. Expect that you will be infected. Expect that you will be exposed, because you will be. Now, whether or not you develop disease or symptoms or not is it's a different thing. But because there's always going to be that brother out there, or that person out there, or that colleague out there who know they sick, but gonna show up anyway to hang out or learn from. So just expect you're gonna get exposed. And I always say, Brother Guyton always says, boost your immune system this time of year. Start taking your vitamin C and your elderberry and stuff like that, because you're gonna get around somebody. I went to the thing we had at the Gaylord 3 weekends ago, the Susan Stiletto. Nobody told me to do it, but I came home. And 3 to 4 days after I had been there, I tested myself, make sure I didn't pick up anything. That was the only time that you ever see me not have a mask on 100% of the time, because I was hanging out. But I still knew that I probably was gonna get exposed, so I checked myself. Negative. So,
Dr. Phillips, homecoming season. You mentioned that you took us there. So
Okay, so what am I saying? All the bros that I know, or the people that I know that are going to be making their annual, pilgrimage, protect yourself. Get your shot. I've been telling the bros that I link up with, if your homecoming is not till the end of October, if you get your Omicron booster now, got a little more protection.
Absolutely.
Got a little more protection. I mean, I think, again, as we have said, under-vaccinated, under-boosted, medical conditions that are out of control. Unfortunately, a lot of our friends and family check those boxes. And if we're going to be in this situation where you have a virus now that, unlike the Delta variant, which was a lower respiratory type of situation, which led to a more delayed presentation, you now are achieving high levels of viral production in these upper airways. So these innocent sneezes, even outdoors, can still be deadly.
Oh yeah. Oh yeah.
So with that being said, what are you doing to protect yourself?
I don't have to tell you guys, it's totally different now. When you go places and somebody coughs or somebody sneezes, I mean, everybody around looks and is like, what's really going on?
Mm-hmm.
So yeah, no, I got that. Let's talk about, just for a little bit here, we got some time. Let's talk about this term that has come out for a while now. This term called monkeypox. Can you define what monkeypox is, and whatever information you can give on it, and then thoughts and feedback on monkeypox?
Well, monkeypox is you've heard about it, is ever increasing. It's one of those contagious diseases from exposure. And from what I know about it, you get it. It's the same class of viruses as the smallpox virus and the vaccinia virus. So that's why we know that the smallpox vaccine in its equivalents will work against it. But it started out from infected monkeys. I think it was a whole lab over in Africa where they were doing research on this particular thing, and it kind of broke out from there. And then it spread, and I think the first case was in the early 1970s, if I'm not mistaken. But here's the thing. It's not like you can run around, you're going to go right down the street by somebody that had monkeypox, you're going to catch it. Or you can walk past somebody that had monkeypox, you're going to catch it. You have to actually be in contact with sores or the fluid from the sores to get it. Now, we know there are certain people that are higher risk than others for getting monkeypox. And these are people that work in laboratories that are doing the identification of monkeypox or working with animals may have it. People that work with the dead animals or things like that, are people that have high risk sexual practices. When we talk about people that men that have sex with men, we call it MSM, have sex with men, is one of the higher populations of it. And you may not know early on when you get it, that you actually have it. And a lot of people just have a mild disease. It starts out as maybe just a mild red blotches on the skin, which may progress all the way up to the pox that you hear about on the skin. Now, if you touch those of an infected individual, you can get the disease from it. But the best thing to do, is to use good common sense if you practice high risk sex. If you know you work in a laboratory or it's going to be handling specimens or anything like that, then do use your personal protective equipment. And that will be a situation in discussion with your physician, your local health department, and CDC, where you might be vaccinated against a monkeypox. Do not handle products and do not touch animals with the disease. And certainly there's some products out there on the market that are made from infected animals that you could get monkeypox from too. So I know everybody's worried about monkeypox. Everybody's worried about being vaccinated. But the majority of cases of those that don't practice a high-risk sexual practice, as far as I know, come from contact with contaminated materials, even on your clothing. If you have the material on your clothing, you still can get monkeypox infection from that. So that's basically what I know about monkeypox at this particular time.
Dr. Phillips is good. So Dr. Boykin, who needs to get a monkeypox vaccination?
Well, like I said, if you practice high risk sexual practices, you should pretty much get it. Obviously, if you're exposed, you want to go ahead and get the vaccine. It depends on where you are and what stage you are with it. If you work in a laboratory handling those specimens, of samples of people that maybe they're looking for monkeypox. I know the case of a lot of people don't recognize, but I know the case of a young man who was in New York, and he came back and he had this red blotchy rash all over his hands. He went to several places, and they couldn't figure out what he was. They kept telling him he had hives, he had this, he had that, because people don't recognize what you need to do about monkeypox, recognize monkeypox. So finally, I think it took somebody that said, well, I don't know if this is monkeypox or not, but let's test it. And then he tested positive. And his exposure was he had a high-risk sexual encounter when he was visiting New York. And that was nobody even asked him his history about that. And he volunteered that later as how he was exposed to it. So, if you've been exposed, if you're going to be in high-risk situations, you might want to think about getting the monkeypox vaccine. But again, there's a set of criteria that you have to go through your local physician has to be in consultation with your health department, which has to be in consultation with the CDC. So you have to meet those criteria for getting the monkeypox vaccine. Not everybody's going to go run out and get monkeypox vaccine, because if you're not high risk is one that, we cannot give everybody monkeypox vaccine, because it'd be a waste of time for those people who really need it. I should say waste of time would be not a good use of medicines for those people who might really need it down the road a piece. Okay.
Understood. Dr. Phillips, talk to us a little bit about your position with the 2nd District as it relates to health and wellness. Give us a little bit of an idea what's going to be happening in the months to come as far as opportunities for people to hear about further health initiatives and things that we want to do moving forward.
So my position in the 2nd District is I'm the health and wellness chair for the 2nd District. So one of the things that we've been looking at, and we've talked about it here on these calls, is how are we going to transition out of COVID? Because I think we have a lot of people that want to learn about how can I be healthier and how can I decrease my risk or vulnerability to viruses such as COVID. So our goals with the Health and Wellness Committee is we're going to start having some regularly occurring webinars where we focus on different preventive health issues. And we're going to be talking about those, because we have seen that familiar faces that speak in a way that we speak is an effective way to get healthcare information to our communities. So using the expertise that we have within the brotherhood and connections that we have as far as collaborations, we're going to try to provide regularly occurring health and wellness topics so that we can continue to help people as far as minimizing their risk of COVID or other viruses that may be down the road. Because as I said a few moments ago, one of the main reasons of our vulnerability was our lack of effective use of preventive care in our community.
Something to look forward to. We're going to keep everything fresh. We're going to keep everything exciting for everybody. So something else to look forward to. I think we're at the point now where we're getting ready to wrap up. So, Dr. Boykin, did you have anything
Well,
before we start to
I
wrap
wanted
up?
to just address one question
Yeah,
people
please.
always have, and one of the questions that came up on one of the offline forums that are looking at this webinar as well. The question was, can I have? I got the pneumonia vaccine last week. I'm about to get the flu vaccine on Friday. Will I have any problems? Well, no, because a flu is a viral-based vaccine, and pneumonia is a bacterial protein derivative vaccine. They certainly can be given together. They can be given along with the COVID-19 shot, if you will. There are a lot of shots that can be given together. Sometimes we give children up to 6 and 8 shots sometimes to catch them up sometimes. So, certainly you can get the flu and the COVID and the pneumonia shot at the same time. Now, there's some suggestions whether or not you should get in the same arm or not. If you do give the flu shot and the COVID-19 vaccine in the same arm, there should be a nice space between them, not very close together because of the possibility of local reactions to it, preferably in separate arms. At least that was a practice that I always did, was giving them in separate arms if I could. So I just want to bring that point up because that was a question that was asked. And you certainly can go out and get both. You get your bivalent and get your flu at the same time.
Outstanding. Well, we're going to get ready for your closing comments. Certainly, as I mentioned earlier, Congressional Black Caucus is in progress right now as we speak. So we certainly want to wish everyone that's in attendance a successful conference. We want everyone to be safe, but we want everybody to enjoy themselves as well. As I always talk about the importance of giving blood. So please make sure you make the time to schedule and donate blood. We want to be in support of our fraternity brother, Dr. Charles Drew. It's probably been hard to see it, but I am representing our vote sweatshirt. So obviously elections are around the corner. We certainly want to make sure that you take the time to go out and cast your vote. So certainly we want to make sure everybody's registered and we participate in the election process. Birthday seasons, it's Libra season. That's my season. But to all that are Libras, all that are celebrating birthdays, want to wish you a very happy birthday. And certainly not least, we want to be in prayer. All of those that are in Florida dealing with this hurricane right now, our brothers, their families, everyone in the community, we're just hoping and praying that all of you stay safe. So let's go to our last comments, remarks for the day. 78, we'll start with you. Any closing comments as we prepare to say farewell?
Well, thank you very much. And thanks again for everyone that's come out tonight to our webinars. As we mentioned during this program tonight, we're going to be taking more other topics into consideration and discussion as we go forward. But for the meantime, my personal opinion is that the pandemic is not over. It's easing up a lot, but it's still out there. We're still having a significant amount of new cases daily. We're still having a significant amount of daily deaths and significant hospitalizations. The group that's always impacted a lot of that you don't hear a lot about are our kids. Our kids probably make up a huge population of patients that are not reported because a lot of the kids are thought as having just a viral illness. So that your kids are very, very vulnerable. Your kids are also very, very vulnerable to routine pediatric diseases that are preventable by vaccination because people didn't get their kids vaccinated because of the misinformation about the COVID-19 vaccine. But I will tell you, practicing over 30 years, I have only seen on one hand any serious adverse effects from vaccines. I'm not just saying it because nobody paid me to say that. It's my personal experience. So do your due diligence. You have to make a decision. Protect yourself. What to do if you've been exposed? Know what to do when you've been exposed. And know what you need to do to get back into the swing of things once you've been exposed. If your children are going to a high risk situation, if you're not against it, and I hope you're not against it, wearing masks, have them wear their mask. Make sure your children have all their routine care. Make sure your children stay healthy and dress appropriately in this weather, because when it gets cold like this, our clearance passages don't work as well. The cold is not going to get rid of the COVID-19 virus, nor it's not going to get rid of the flu virus. It's going to be out there on surfaces and everywhere like that. So do your due diligence. Be well informed. Don't listen to someone who has not data to back themselves up, or just based on one case out of 500,000 cases of something that then may have an untoward effect. Do what you know is important. Make sure everything is vetted, and please don't fall victim to misinformation out there. So thank you very much. Have a good evening.
Outstanding. Dr. Phillips.
Well, I'm afraid I'm gonna frame my comments because it's homecoming month, and homecoming month is the time that everybody likes to be out. Protect your outness. And what does that mean? That means that if you have risk factors, what are you doing to work on them? If you have not gotten your vaccinations, I highly recommend that you update, get your booster, finish your primary series, get your Omicron booster, whatever of those apply to you, get on top of it. Because again, what we are still seeing is that the people that are getting seriously ill, the people that are getting hospitalized and even dying are those that are vulnerable. So again, for all of that, us that have put our outness in the back for 2 years plus, we ready to enjoy it. And if that's what you want to do, make sure you're doing it in the safest way possible. So with that, I thank you for your time.
Outstanding. Well, for our guests that have been watching, for the brothers that have been watching, let me let you know tonight you have had a trifecta, and it's been a trifecta of the eights. It's been 78, 88, and 98. So I appreciate you watching. Listen, make sure you tune back. We're going to make sure that we have the most up-to-date information. As always, we ask that you continue to stay safe. Stay safe. Stay safe. We want to give a shout out to our engineer behind the scenes, Brother Piercy, making all of these things happen. We appreciate you, Brother Piercy. And again, a shout out to our district representative, Brother Delrico Gales. Thanks for allowing us to do this. And certainly our grand boss list, our 42nd grand boss list, Brother Ricky Lewis, leadership at a prime time that we have going on in these times. Thank you so much. Continue to stay safe, stay well, and we'll catch you next time. Be well.